There is one civilization that ate a single bulb raw every day for over 4,000 years. Their oldest medical texts prescribe it crushed, never cooked. Their priests consumed it before rituals. Their soldiers ate it before battle. Their mothers gave it to children at the first sign of illness. Across 4,000 years of documented medical practice, this civilization recorded something that modern cardiology is only now beginning to confirm. Rates of cardiovascular disease in populations that consume this bulb raw are consistently and dramatically lower than in populations that cook it. The bulb costs less than 10 cents. It grows in every climate on Earth. You already have it in your kitchen. But you are almost certainly using it wrong because 60 seconds of heat destroys the single compound that makes it medicine. 60 seconds. 1 minute in a microwave or 6 minutes in a pan, and the enzyme responsible for every cardiovascular benefit this bulb provides is completely and permanently deactivated, not reduced, destroyed. I am going to tell you which bulb, which compound, and the 10-minute trick that turns a common kitchen ingredient into one of the most powerful cardiovascular agents ever studied. But first, you need to understand what 4,000 years of medical texts were actually telling us. The civilization is India. The bulb is garlic, Allium sativum. The oldest Ayurvedic medical text, dating to approximately 1500 BCE, prescribed garlic for heart conditions, digestive disorders, infections, and fatigue. The Karaka Samhita, one of the founding texts of Ayurvedic medicine, documents garlic as a treatment for heart disease and attributes to it the ability to strengthen the heart muscle, clear blockages, and reduce swelling. This was 3,500 years ago. In ancient Egypt, labourers building the pyramids were fed garlic daily to maintain strength and prevent disease. The Ebers Papyrus, one of the oldest surviving medical documents from approximately 1550 BCE, lists garlic as a treatment for over 22 conditions. When the garlic supply was interrupted during construction of the Great Pyramid at Giza, workers reportedly went on strike. It was so valued that 15 pounds of garlic could buy a healthy male slave. Hippocrates prescribed garlic for respiratory problems, parasites, and poor digestion. Roman soldiers ate raw garlic before marches, believing it gave them courage and endurance. Roman naturalist Pliny the Elder documented 61 medicinal uses for garlic in the 1st century. Chinese physicians used it as a digestive tonic for over 3,000 years. In every ancient medical tradition that encountered garlic, one detail was consistent. They used it raw. They crushed it, chewed it, or pounded it into pastes. Korean cuisine still serves raw garlic cloves alongside every meal. Traditional Japanese medicine prescribed raw garlic for fatigue and circulation. Indian golden milk combines crushed raw garlic with turmeric and warm milk as a nightly cardiovascular tonic. They did not fry it. They did not roast it. They did not throw it into a hot pan with oil. The reason was not superstition. The reason was chemistry they could observe but not yet name. When you crush a raw garlic clove, you rupture cell walls that normally keep two substances separate. One is an amino acid called allin. The other is an enzyme called allins. When the cell walls break, these two substances meet and react within seconds to produce a compound called allicin. Allicin is garlic's built-in defense system. In the wild, it functions as a natural insecticide. When a pest bites a garlic clove, the cells rupture, allicin forms, and the pest dies. In the human body, the same compound acts as an antimicrobial, antiviral, anti-inflammatory, and cardiovascular agent. Allicin inhibits cholesterol synthesis in the liver. It relaxes blood vessels by increasing nitric oxide production. It prevents blood platelets from clumping together, reducing clot risk. It scavenges free radicals. It suppresses inflammatory cytokines. One compound produced in the 6 seconds after you crush a clove that targets 5 separate cardiovascular risk factors simultaneously. No single prescription drug does this. Allicin is the reason garlic works, and allicin is destroyed by heat. A study from 2001 by Song and Milner at Penn State found that 60 seconds of microwave heating completely destroyed all allinase enzyme activity in uncrushed garlic. Without alliinase, allin cannot convert to allicin. The cascade stops. The medicine dies. Oven heating at 200 degrees for 6 minutes completely suppressed garlic's ability to inhibit platelet aggregation in uncrushed cloves. Boiling garlic at 100 degrees for 20 minutes eliminated its antibacterial activity entirely. When you cook garlic whole or toss uncrushed cloves into a hot pan and you're eating flavour, you're not eating medicine. The Allicin never forms. Every cardiovascular study that showed benefit used raw garlic, aged garlic extract, or garlic preparations that preserved allicin or its derivatives. Studies that failed to show benefit disproportionately used cooked garlic powder with low allicin yields. The preparation determines everything. Here is what the science shows when garlic is prepared correctly. A comprehensive 2026 meta-analysis published in Nutrition Reviews analysed the results of randomised controlled trials on garlic supplementation and cardiovascular risk factors. Garlic significantly reduced total cholesterol by 10.2 milligrams per deciliter, LDL cholesterol by 5.9, triglycerides by 5.8, fasting blood glucose by 2.77, systolic blood pressure by 3.71 millimeters of mercury, and diastolic by 1.97. It also significantly reduced C-reactive protein, tumour necrosis factor alpha, insulin and insulin resistance, while increasing total antioxidant capacity and HDL cholesterol. An earlier meta-analysis focused specifically on hypertensive patients found garlic reduced systolic blood pressure by 8.7 millimeters of mercury and diastolic by 6.1 in patients with elevated baseline readings. An 8% reduction in serum cholesterol has been associated with a 38% risk reduction in coronary events at age 50. Garlic also significantly reduced the number, duration and severity of upper respiratory infections in clinical trials, confirming the immune-boosting effects that ancient physicians observed but could not measure. And here is the detail that ties everything together. The meta-analysis showed that non-powder preparations, which are closer to raw garlic, reduced cholesterol by 15%. Dried powder preparations reduced it by only 8%. Raw garlic is nearly twice as effective. The ancients knew, we forgot. If you are still here and this is changing how you think about your kitchen, hit subscribe. We are doing this every single week. Here is the honest caveat. Garlic is not a replacement for statins in patients with severely elevated cholesterol or established cardiovascular disease. The evidence is strongest for mild to moderately elevated cholesterol and blood pressure, and for general cardiovascular risk reduction through anti-inflammatory and antioxidant mechanisms. Individual trial sizes vary, and the most aggressive pharmaceutical companies in the world have no incentive to fund a definitive trial of 50,000 patients on a bulb that costs 10 cents at any grocery shop on Earth. You cannot patent garlic, you cannot patent allicin, you cannot restrict access to something that grows in every garden on the planet. The statin market is worth over $15 billion globally. Lipitor alone generated over $140 billion in lifetime sales before its patent expired, making it the highest grossing drug in pharmaceutical history. The average American on a statin pays from $20 to $50 per month and takes the drug for decades. Side effects include muscle pain, liver damage, increased blood sugar, and cognitive issues that patients call statin brain fog. Garlic costs less per year than a single doctor's visit. Unfunded does not mean disproven, it means inconvenient. Here is what you can do tonight. Buy a bulb of fresh garlic. Crush or finely chop 1 to 2 cloves, then wait. This is the step that changes everything. Let the crushed garlic sit at room temperature for 10 minutes. During those 10 minutes, the alliinase enzyme converts allicin into allicin. If you skip this step, you lose most of the benefit. After 10 minutes, eat the garlic raw. You can swallow the crushed pieces with water like a supplement. You can mix them into honey. You can stir them into hummus, salad dressing, yogurt, or guacamole. Anything that does not require heating above 60 degrees. If you must cook with garlic, crush it first and wait 10 minutes before it touches heat. Even then, add it in the final minutes of cooking, not the first. The clinical dose used in most studies is the equivalent of 1 to 2 fresh cloves per day. Side effects are minimal. Garlic breath is the main complaint, but chewing raw parsley or fresh mint leaves immediately after eating raw garlic neutralizes the odor. The chlorophyll binds the sulfur compounds responsible for the smell. Some people may experience mild gastrointestinal discomfort. If you're on blood thinners, consult your doctor, as garlic has antiplatelet properties that may enhance the effect. Do not take high-dose garlic supplements before surgery. Now picture this. It is 10 years from now. Every morning you crush 2 cloves of garlic from the bulb sitting on your kitchen counter, the same counter where it has always sat, and you let them rest for 10 minutes while you make breakfast. Then you stir them into a spoonful of honey and swallow. Your cholesterol panel has been normal for years. Your blood pressure sits where it should. You stopped refilling one prescription 3 years ago under your doctor's supervision. Your neighbour asks what changed. You tell them about a civilization that ate one bulb raw for 4,000 years and recorded some of the lowest cardiovascular disease rates in the ancient world. You tell them the compound that makes garlic medicine is destroyed in 60 seconds of heat. You tell them a 10-minute wait after crushing is the difference between food and pharmacy. You tell them the statin market is worth $15 billion and the bulb that competes with it costs 10 cents. You tell them 4,000 years of medical texts all said the same thing. Crush it, wait, eat it raw, we just stopped listening. We started cooking it because it tasted better, and in chasing flavour we destroyed the pharmacy that was sitting on the chopping board the entire time. If you want to go deeper, head to our website where you can grab our ebook on lost plant remedies the system forgot but the science never did. Thanks for watching, click here to check out another video, make sure to subscribe.